Well, good morning, everyone. So good to see you all this morning, bright and early. I would like to call this meeting to order at 8:04. And we do have quorum, so we will go ahead and if, review the minutes from last meeting, which have been distributed and are available online. Are there any questions or concerns about the meeting minutes? And if not, I would like to call for a motion to approve last meeting's minutes.
So moved. This is Colleen.
Thank you. Any, all in? Go ahead. Second motion,
I'll take a second. It's Melissa.
all in favor?
Aye.
Aye.
Any opposition? Okay, we will approve the minutes of last meeting. And now I'm going to present the agenda. Share my screen for a second. Okay, so we will move on to committee updates next, starting with the chairs of the committee in this order, starting with academic public health collaboration, community engagement, and then governance and nominating. We will hear from the wonderful Shantae Flewellen this morning to give a report on the community outreach and engagement, and we'll do any important announcements before we close today. So without further ado, we'll go ahead and start with committee updates, and I'll start with you.
Hi, Kristen. Thank you. Hi, good morning, everybody. I think we have not met this month, but I just wanted to give you the update of what we're working on is trying to figure out how to best partner the action teams with academic health partners. And the other piece is looking at if there are tangible opportunities for faculty to work a portion of their time at the health department. So we started working with Dr. Mati on that. And that's the latest update. Please let me know if you have people or in your spheres that are interested in working and helping and volunteering in their expertise. Thanks.
Thank you, Dr. Shacham.
Can I ask a question really quickly about that?
Absolutely, Colleen.
I love that idea. And is there a way to help support that protected time for faculty members to do that? Or is this a request for folks to be just volunteering their time to be working with the health department?
That's what we're working on, actually.
Okay.
So that's the that's harder to sustain, and I think that the key for much of this has been how do we make this sustainable? So can we build out an opportunity for 25% of somebody's salary to be coming from a different avenue, like the health department?
Wonderful. This is Melissa. I also love that idea. And I think if you can figure out a systemic way to do this instead of it being volunteer, then it's going to be more equitable for those faculty as well. Otherwise, you're going to find wonderful people, right? But then who that volunteer time is taking away from their job, and all of a sudden promotions and things like that may be impacted in a negative way, which is what we don't want, right? We want this work to be valued by the universities and for that to come across in the system that's made. So thank you so much.
We'll see. I'm going to try.
Keep working at it. That's right. Right. You got to try.
Thank you.
I love it. Great questions. Thank you so much, Dr. Shacham. Okay, next update will come from community engagement, which I chair, and members of that committee are Dr. Tapey, Dr. Ludy, Brittany Jones, and myself. So we did meet earlier this month, and we had the wonderful Shantae to come join us and talk about the new, please correct me if I'm saying this wrong, the community engagement and public information sector. Okay, community outreach, is it outreach? or it's engagement?
It's that we actually refer to it as outreach, but outreach and engagement is formally what it's titled.
What it's titled. Okay. And you're going to hear more about that today. But we wanted to meet just to make sure that our efforts as a committee was in alignment with what the department felt like they needed most, from the board at large, but specifically some of the board members who happen to be on this committee that do a lot of work inside of the community. So we talked about collaboration. We kind of reviewed some of the thoughts and planning that Shantae has put together, and helping with supporting the rollout, thinking about what partners that aren't current partners of the department that would be great collaborative partners to sustain these efforts. And so if you do know of an organization that you're connected to that you can vet that would be good partners, please send that to myself, or you can actually send it directly to Shantae, whichever makes you feel most comfortable. We also were trying to support the distribution of COVID testing this season, considering that, the viral counts are increasing. So trying to find organizations that do support community members, particularly those who have housing insecurity and those who may not regularly have someone in healthcare that they visit and see for their wellness. So places like the Brick, where we have a lot of outreach support. Dr. Ludi works with a lot of different outreach organizations and some shelters, where we figured just some COVID testing home kits would be effective just in this season. And then we just plan to continue to have additional conversations about how we can align our efforts in supporting the department with their outreach program. I'm going to pause for a second and ask my committee members if I missed any important updates. And if I did, please come off mute and share. Yes, Dr. Ludi.
Yes, good morning, everyone. It was a very good meeting, and we all got some ideas to share about how we could work together. I sent my order in for some test kits over the weekend and got an answer on Sunday evening, which I thought was amazing. And what I hear is that I should be able to pick it up today. So I thought that was very responsive and much appreciated.
Awesome. I love to hear that. And anyone else from the committee had anything they wanted to share? No pressure. All right. Well, oh, Shantae.
Yeah, I was just going to mention that in my presentation, I do make a reference to our great meeting and some of the outcomes. So it's similar to what's been said, but yeah, I'll be touching on it as well.
So thank you so much.
Mhm.
Well, it's perfect timing. Chair April Meckens-Jolly is here, and
Good morning.
the last committee to report out would be the Governance and Nominating Committee, which she chairs. So I'm going to turn it over to you twice, April.
Thank you. Thank you all for being gracious with my tardiness. When we met in August, we looked at a document that our committee had drafted, which was a work plan. And we talked about whether we should make that document or something similar to it a standard practice for how committees function. And so I wanted to actually, instead of talking more about the work of the committee, wanted to pose a question to this group and see if we could set that as a standard and ask each committee chair to work on developing a work plan using that standard format, or if there were some additional edits or changes that needed to be made. So if I have the capability of sharing, which I do, I'm going to bring up the work plan. Can everyone see this document? This is just a very simple Word doc. We also talked about the fact that we do not yet have a singular place to store documents related to our work. And so we can also certainly think about keeping this on Google Drive or Dropbox, and I can make sure that everyone has access to it who needs it. But this was the template, right? The issue, the topic, making sure everyone knows what the main role and purpose of the committee's work is. And I did not hear, I don't think, after rewatching last month's meeting, many comments about this template, but the questions were really centered around whether everyone should be using it so that we can track outcomes in a similar fashion. And then the other thing that was mentioned was Liz writes, graciously offers to create a more detailed work plan, which she has drafted for the work of nominating and governance, which I will also show you all in a moment. So there's actually a second document that you all can think about using, and we can also talk as a group about whether we want to use multiple documents to track specific tasks and outcomes as we move forward with, ensuring that we are adding value to the work that the Department of Health staff are also trying to work through. So this is the template. It's now blank. This is just something very simple. Before I open the other more detailed work plan document, do folks have additional feedback or questions about using a template such as this? I don't see hands raised. Okay. I will pose, I guess, a quasi vote to folks in just a moment. I'm going to show you a sample of a work plan that our colleague Liz created. So this is based on the work plan that I shared with this group last month. So thankful to have folks on this board who have so many talents and skills, such as project management. But Liz took the elements that were in that work plan template and made sure that we had a way to track the status of some of the things that we had put into the work plan, so that we can have more clarity about exactly what does it take to produce the outcomes that we are hoping for. And so this is a more detailed guide about exactly what does it mean to, for example, review annual goals and committee charge. What needs to happen to make sure that that goal is actually achieved. And so it's a more concrete way to note each of the steps that need to happen, and also who's in charge of it, actually getting it done, any start or end date, and noting the status, which is here in column G, and also any notes or questions that your committee needs to ask or answer. So this is, a more detailed way to track what is a more generalized work plan. This one takes more thinking up front to make sure that you've really thought about how you're going to achieve some of the goals that you set for the year. But I personally think this is a pretty helpful tool, and something that, whether you are part of that committee or not, can very easily see what the committee is working on, the tasks that are happening or that are planned, and where the progress is in getting those things done. Do folks have comments or questions about this document or this format? I'm having a hard time seeing everybody.
I have a question.
Yes.
Hi, it's Enbal. I am, don't get mad. Tell me where I'm supposed to find, because I feel like we don't have a charge or a list of expectations for, let's say, the Academic Health Partnership subcommittee. We don't. I made it up. And what are the outcomes? Who's deciding what the outcomes of that we want to track? And yeah, for starters.
I'm actually not going to answer that right now. I'm going to pose that to the full group. I think Kristen has her hand raised.
I was just going to say in our last meeting, Dr. Imbal, that actually came up. Like they were like, so what is the charge? And we kind of spent some time talking about what like each of our perspectives were. We also had the pleasure of having Shantae, who works at the department there, and so had the opportunity to ask someone that is of like from staff, like what would you like to see? I do think there could be a more formalized conversation in committee groups, and then expand it to the board at large to kind of define what that means. So, as we transition off, our board duties and new people come in, they have some sort of, foundational, what am I looking for? Bars to grip on as they, understand their role. It could be helpful. So I just wanted to validate that we were also kind of in that space. While we have a title and a small description, she was like, yeah, what is it that we're supposed to like fully accomplish? So we also kind of made it up, if you
Okay.
will.
Yeah, that feels better. Thank you.
You're welcome. In relation to these two documents, April, I feel like they're great. I used to work with Liz, so when I saw that, I just had to smile and grin because she's very much project management, and I love her energy as it relates to like organization. I think it's helpful. I also think to adopt a new practice, people may kind of grab what feels most comfortable initially until we kind of decide what way we want to retain that information historically for the board. My thought was until like, I know meeting regularly is challenging with the different schedules. I wonder if it would make sense in this season. Well, I think these should be disseminated to whomever can like activate them and use them now for their planning. I'm wondering if for the DOH purposes that we could commit to some sort of quarterly report. Nothing very formal, I guess, but something that just lets the department know what our progress has been in a quarter span. You may meet once in a quarter, it just kind of depends on time. You may meet a couple of times, but I think just letting them know what our efforts are and some sort of, when I say report, that sounds so official, but I just mean some sort of update, thoughtful update with where things are, could be helpful until we get comfortable and used to adopting like new project management practices. I like it, and I know that all of this feels very new to folks. So again, maybe even starting with a charge could be step one, before we like dive into actually like what are the goals that we're going to accomplish over the next year or whatever. That's just a Kristen thought.
Thank you. I appreciate that. And I guess I have a question. What has the Academic Community Partnership Committee seen as its charge or its work in the past? Or is this really kind of the first time that that this question has been posed about what is the charge? Because it is a blended group. It's not just run by members of the Board of Health.
Right. I joined maybe 2 meetings ago, and now I'm the chair of the subcommittee. So, and I wasn't provided anything. I'm gonna leave it at there.
We haven't quite set you up for
No.
excellent.
So I do think the idea of like building something and saying and being able to pass that thing off, I think Craig has been decidedly tremendous, valuable resource to say, these are the things that we've been doing. And there's like MOU development. And I kept saying, like, for what end? What do we want to do with that? And I think those are important foundational things, but we want to know what we're going to do with it. So
Yeah,
Yeah, April, if I could
Yeah.
interject here. Good morning.
Mhm.
So yes, Dr. Enball has taken this by the horns and is moving us forward as you all are. We started historically with an academic health department that was funded with St. Louis County, St. Louis City, and St. Louis University at the time with the Missouri Foundation for Health. That goes back about 3 years or more. It is no longer funded, but as part of that, there were a lot of meetings and get-togethers with various committees, including research and policy, training and workforce development. There were efforts, of course, that were interrupted to some degree by COVID, but we can't rely upon that forever, but that did have some impact. So the effort was to try to bring in, as Dr. Enball talked about now, that could be more formalized in terms of academics coming into the local public health department and vice versa, with local public health department practitioners going into academia to kind of share and talk about areas of subject matter expertise, developing policies and so forth. That has morphed into other areas where, of course, our commissioner comes from Washington University, and there have been individuals from Washington University and St. Louis University on this Board of Health. And so MOUs to kind of set out some of that structure. There's also been a relationship with the law school over at St. Louis University. So the world is our oyster to some extent, but part of this is grappling with, what will that infrastructure look like? One of the areas that Dr. Enball Shockham just talked about was really trying to connect with the Community Health Improvement Plan, which provides so many opportunities for research, potentially policy development, and some of the expertise that's on this Board of Health and Hospitals. We did present this and move it forward to the Community Health Improvement Plan folks within the Department of Health. And they are trying to make sure that, as we move into implementation, we're not overloading the action teams, because at this point, they're really trying to encourage them to do some of the reporting obligations that they have and then move into what some of these opportunities might be. So we really need, as part of this, to get their input as to how best to use the expertise that exists on this committee. I think that's sort of where we are.
That's a helpful summary kind of how this collaboration started and where it is now and what possible plans could be. As I am listening to the work that the academic public health collaboration is focused on and community engagement, I wonder if there need to be closer ties between those two committees. One of the challenges of kind of how community health and public health work has been done is that it's been happening in silos. when, of course, all of this work is intersectional and related. And so I am not saying that I think these committees need to be merged. But are there some, like, as we're thinking about being clear on what the charge is, that sounds to me like there also needs to be clarity about what the relationship needs to be between committees that are focused on similar outcomes ultimately.
I'm collaborative in nature, so I think the more we can have expertise at the table, particularly because I don't think that, one sole person knows all things, and I think our experience and connections can lead us to different innovative solutions. It also helps spread the work out as it relates to like it not feeling so heavy when you have a lot more thought partnership. Um, so it could be that it sounds like to me we may be starting back in a more foundational phase. I'll also say I know the community engagement committee is new and they didn't get the opportunity to meet when it kind of was born. And so our this year would have been, we've had 2 meetings for the history, is my understanding, for the history of that committee. And so it still feels very new. Shantae's program is very new. So I think it just sounds like a good time to maybe level set. And then to your point, April, with these documents that maybe can be found somewhere, that could also be a helpful track for new members if they want to learn more about the historical programs and efforts of that committee. When they onboard, they could read through those work plans or quarterly reports and have a space where they can deepen their understanding of what their role would be on that committee. And I think that could be helpful, especially in first meetings. I felt like sometimes I was just like, I'm just going to listen because I'm not sure where to pick up the baton, and want to respect the historical efforts in the space. So I think grounding us could also make us feel more confident that we are kind of doing the things that the department wants, that we feel like we can do. And I think where there is intersectionality between what others are doing in their committees, I think chairs could probably arrange some sort of connection where there could be a broader conversation, or maybe if there's an opportunity for us to spend board meeting time as a group to talk about, here's a question I wanted to ask the board that came up in our committee, and I wanted to invite everyone to kind of, thought partner in that. Maybe that's another opportunity while everyone is in this space, and that's protected time, depending on what other things need to be reported out. But I do think there's room for both. That was the long way of saying that. Thank you.
Love it. I am also a both and thinker, so. I'm leaving space for other folks to chime in.
I just wanted to offer, as it relates to those 2 committees, coming together to find innovative means to support the CHIP, that in outreach, there are some things that we've already initiated to ensure that the Department of Health does support or does provide that support. As a part of, I was a part of the leadership team for the CHIP, the development of this regional CHIP. And one of the things that came out of feedback from the community was the fact that they felt like they didn't have as much support from the departments, and they wanted more support in getting information out about the CHIP, about the different priorities. And so we did take that to heart. And we, in our section, we have developed and are working on developing informational pieces that we can share during outreach events. We also, for the launch of the CHIP, we made sure to give them materials that they can, as separate priorities, then utilize tools. I know it seems aesthetics, as far as tablecloths and signage and things like that, and just informational pieces. So, but I would really be interested to see how this grows and other things that can be identified to help share and get information out in the community, and with the intent of hopefully identifying additional partners that can come on and to take on or lead the charge in different strategies. So if there's any way that we can assist in that space, providing updates, sharing updates, being a part of supporting those efforts, just let us know.
Thank you. It sounds like this is a topic that needs to have dedicated time and space. And we also need to probably have a meeting of the chairs before the next meeting. So Kristen, Dr. Shockham, I think that the three of us need to meet before the October 17th meeting. And maybe develop the strategy for how that meeting needs to dig into this, to the issue of ensuring clarity of purpose for each of the committee charges, and thinking about how the work of these committees needs to be intersected with each other and with existing efforts, so that there's this bi-directional way of making sure that everyone is, in the loop, for lack of a better phrase. If folks are comfortable with that, I am eager to hear from Shantae and hear about this community engagement strategy, because obviously it's very pertinent to everything that we have just been speaking about. So if there's no further comments about committee updates, I'm going to give the floor to Shantae so we can hear more about the work that she's been leading. Thank you.
Thank you so much. Okay, I'm going to share my screen. Hopefully everything still stays in place. And here we go. Thank you so much, Board of Health, for the opportunity to provide this update on our recent activities and also the plan that we have in place for outreach and engagement. As Dr. Mahdi has shared in previous meetings, I'm charged with leading our outreach efforts from an evidence-based standpoint to ensure that our activities and outreach in the community is performed in a way that is equitable and meets the needs of the community at large. To ensure that we achieve this goal, I've developed a plan that is aligned with the vision and mission of the Department of Health, ensuring the accessibility of health information, resources, and services for all. The plan itself is anchored by 4 key objectives, which are shown here. The first of which is to ensure that we perform comprehensive monitoring and reporting of all of our outreach activities so that we have a clear understanding of our impact in the community. The next is to strengthen our partnerships by improving our ability to build and maintain relationships with existing community partners, establishing MOUs to ensure that we're aligned and support one another in our efforts to reach the community. The next is to act as a convener and connector for smaller grassroots nonprofits to ensure that they have the resources that they need through the larger community stakeholders as well as city departments. And last but not least, ensuring that our staff are fully trained and are capable of providing quality customer service with each interaction in the community. This is done through training and ensuring that our staff have a clear understanding of what it means to perform outreach and to report it effectively. Activities related to the foundational objectives of this plan have already been in place for some time or have been happening for some time. A quality improvement project that was based on last year's strategic plan focused on improving monitoring and reporting of our outreach efforts. Upon assuming my role in December, we began tracking of our outreach, and as a result, you can see that we're beginning to have a quantifiable picture of what it is that we do in the community. Most notably is the fact that we've reached, as of August, upwards of 11,000 people based on our internal reporting, and we know that we've participated in over 100 events. The fact that we're able to quantify our efforts has been a definite game changer and brings to light the impact that we've had for so many years, as many of the events that we participated in this year, we participate in every year. I'd like to also highlight the map that indicates where we are focusing our efforts and areas that we may want to think about improving what we do. Also, the fact that we're tracking in this way helps us now better utilize this information along with other references to determine if there's where there are opportunities to improve. Because our communications team is also a part of the outreach function, I would be remiss not to include some of their activities as a part of outreach. Through our monthly reporting and social media, we are able to share key information on various public health topics. To date, we continually expand our reach on social media, notably having over an average of 13,000 followers a month over 4 platforms. We have also expanded the reach of our monthly reporting, where we share not only with you, our Board of Health, the activities of the department, but then we share with our stakeholders. In the beginning, the report was shared with upwards of 405 times. But as of last month, our reach has put our monthly report in front of over 855 people. And the number of presentations that we have given to date also reflects the commitment to outreach from the top down. Our very own Dr. Mahdi has presented on various public health topics to diverse audiences 54 times this year alone, and subject matter experts from different bureaus have equally been impactful, presenting over 60 times and counting. As we go into the fall, outreach has been preparing for the onset of the respiratory illness season. To ensure the Department of Health is responsive to the needs of the community, we have been preparing to do several things. First, we will be supporting St. Louis Public Schools with supplies to slow the spread of respiratory illness. Within the next few weeks, our director, along with many team members, will share supplies to ensure the classrooms have what they need to minimize exposure and have information regarding things that they can do to stay safe and where to find resources such as vaccines. The supplies include COVID tests, child-sized masks, hand sanitizer pumps for the classrooms and hand wipes, antimicrobial tissue. I did not know that was a thing, but I do know now. It's amazing. I love it. And then sanitizing surface wipes for the classrooms as well. In addition, the director has required that all bureaus and community health workers that are out in the community, they're required to take COVID tests to all outreach events and information as well as the health van is at all times stocked with COVID tests for providing to the community as well. We are very proud of the vehicles that we purchased with ARPA funds to help us meet the needs of the community during the pandemic. With the end of the emergency declaration, we are intentional about making sure that we maintain familiarity with how to operate them so we're prepared in the event of another major impact. Currently, we are regularly, if I could say the word, used. They are regularly used by the department bureaus for outreach events to ensure that we're familiar with how to operate them and the locations to best connect with the community, again, in the event of another pandemic or other community impact. Beyond that, the health vehicles have taken on a more inclusive role. There are plans to make these vehicles accessible to community partners. Aligning with our outreach plan's objective to focus on strengthening partnerships, the use of the health vehicles by our community partners aims to empower them to expand their services more efficiently and with a wider reach to a wider community segment. Not only does this innovative approach enhance the visibility of the vehicle itself, but it also encourages collaboration amongst various stakeholders to advance public health and well-being citywide. Some examples of this are some great examples. We are finalizing a general use MOU that some community partners and subcontractors can use to enter into agreement with us to utilize the vehicle to expand their reach. For instance, we'll soon be entering into an MOU with Greater Health Pharmacy. They'll be utilizing the van to deliver prescriptions to qualified patients in areas identified as pharmacy deserts. In partnership with Affinia, community health workers are currently sharing public health information and COVID tests take-home test to the community at a local library once a week with the intent to grow their outreach efforts in the near future. The support of the Board of Health Outreach Committee has been nothing short of amazing. To build a program related to outreach from scratch is no small feat, and having the feedback from the committee members on the plan and ideas for how to realize objectives has been tremendous. And I look forward to sharing updates on our efforts on a continuous basis and their guidance in the future. So on behalf of our department, I would like to express the utmost gratitude for your commitment to these efforts and our success. So thank you. And with that, I will end my presentation and open it up for any questions that you may have. Let's see if I can stop share here.
Thank you so very much. I really appreciate getting updates directly from you and from other folks on the staff, because we know that you all are doing so much more than we can even see publicly. So I really appreciate that you can give us some additional context about not just what all you all are focused on, but also the way that you have very clearly aligned it with the strategy. So thank you.
Thank you.
I have a question.
Sure.
In terms of the partnerships that either the department has or ones that you're maybe thinking about, are there some partners or perhaps areas of the city that you are especially focused on? And if so, if you have something planned, I would certainly love to hear it.
So the plan itself is a work in progress. All of what we do is based on data. A lot of the areas that we focus our efforts, for example, I mentioned the community health workers being out with our family, school, and community health and Affinia. The places that they set up the health van, that is by design. It's based on areas where they know that they'll have the most impact based on data. I have not had an opportunity. We've been collecting data for almost a year. And my intent is by the end of the year, taking the data that we have collected and comparing it to other information that's out there about the disparities that are within the St. Louis City footprint, and doing an overlay, just seeing where we are connecting, where we're being most effective, are there gaps in where we've been reaching over the past year, and then adjust. And I think that in going forward after that fact, then we will be able to do that maybe on a quarterly basis, be able to just so that we have that level set and adjust where we are driving our efforts. So I hope that answers your question.
It did. Thank you.
Okay. Mhm.
I just want to say excellent job, Shantae. That was a really wonderful presentation.
Thank you. I appreciate it. Look forward to sharing more information. I'm so excited about this plan. I'm so excited about the data. The quality improvement project was very near and dear to me. And so when it first started, it just seemed like, it was a labor of love. It was just all this empty, spaces for the information. But it's now September and we've collected all of this data, and just to look at the outcome reporting, it's just beautiful. All these numbers, everything is quantifiable, because again, the Department of Health has never not been in the community. We've never not been front and center, active in the community, healthy partnerships, but we never knew, we couldn't quantify it. We couldn't tell in numbers what it was that we're doing. So when we did the numbers for August, and Matt Holden, one of our epidemiologists, comes back and he's like, yeah, it looks like over 11,000. I was just stunned. It was amazing. And then just the number of speaking engagements, the number of events. And I know we'll just get stronger, better, faster, just in light of having a better understanding from a data standpoint, we'll just get stronger, better, faster. So.
Thank you. I do have one last question.
Sure.
Since we were talking about the regional chip earlier, are you able to bring this data to the chip table? Because I wonder if I'm going to just assume that there are multiple outreach efforts taking place, both city and county.
Yes.
So like, for instance, if there's a major festival taking place, do you talk to counterparts in the county about, we have this opportunity to do, community outreach? Is there a regional element to it, or is it, if this event is in the city, then it's purely the city's role?
So our intent was to act as a support, because this is a regional effort. The materials and the things that we are developing, it's for everyone. It's for all priorities. It doesn't matter if there is an outreach opportunity for us to set up a table. We have table, I know it sounds silly, but it really isn't. We have chip tablecloth, signage, the informational pieces. They can go anywhere at all. We have we'd like to develop materials for each of the priority areas and be able to share that as well. And I have included on my end, and it hasn't been a joint conversation between us and St. Louis County, but just to ensure that we did our due diligence, we made sure to incorporate some funding within our budget to dedicate towards the support of the chip. And so, like, development of those materials that highlight and break down what the different priorities are working on. We have the resources to help print those materials. We were also open to supporting any of the priority areas if they want to have a public facing event, meeting to discuss what they're doing, updates, things like that. We're just poised to stand as a support. And to your point, I think that we probably should have a bigger conversation with St. Louis County and make sure that we're doing it together. So at this time, we have much of the materials here, but that doesn't mean that they can't go to St. Louis County or go to one of the priority team leaders. If they need it, we have it and we're ready to support.
Yeah, and I want to mention that there has been some discussion with St. Louis County already about doing and attending some events. We've talked about, doing maybe a table at Earth Day or something, and working in partnership with Shantae. We just recently hired our new health marketing administrator that will be, our managing and leading our chip. And she's already set up better reporting and monitoring mechanisms for them to report on their data that they're collecting. And she's drafted a brochure that I think she's already met with Shantae on the brochure about the priorities that we hope to get out with the chip. Another thing that we were working on was creating some type of survey so that when we're doing outreach, that we can actually hear from the community about their needs and wants, and better, then develop strategies to those needs and wants. So, and the other thing I wanted to mention was we, in the past, we had Serena Muhammad, who is leading our violence prevention initiatives. And then we had Tim McBride, who was co-leading the intersection of health and economic mobility. Now he's on sabbatical. The other co-lead is Julie Gary. So we are looking for someone to help co-lead that section of the chip.
Rhonda, it sounds like you're making an ask.
I want to put it out there. Yes. I don't know if anyone's, interested in taking on such a role, but yes, we definitely would like someone to help with that.
Perhaps that's something we should note in the minutes and provide some additional information to members of this board. Thank you.
Mhm.
Did someone was someone else about to chime in? Shantae?
Yeah,
Yeah.
I did. I just wanted to add quickly that we can also use our social media presence on several levels, just to share information about the different priorities. And we do have we do intend to do that, as well as if if they're seeking some level of feedback from the community, offering our social media platform or our presence as an opportunity to share that, that survey on that space as well. So those are other ways that we're helping to support.
Shantae, when you say survey, are you talking about, so one thing I thought about, the numbers are amazing. So congratulations to the efforts of your team. And wondering mixed methods, so great broad reach, understanding more about the individual impacts of that reach. So like, yeah, we saw 11,000 folks, which is incredible. And they are saying that our efforts have really impacted their health in a positive way. They understand that we are the resource to go to in the city for these things, So I'm just curious of, alongside that data, what the experience is, and how that can inform and maybe from a sustainability standpoint, just kind of continue to influence whatever shifts that may be required as you all continue to build out engagement that's equitable for the city.
Absolutely. So one thing that I know that Rhonda and I have had conversations at length about is leveraging our presence, whether it be in-person interactions or social media, and being very intentional about capturing the questions like that, and making sure that we're asking the right questions and how to achieve that. I know that also in going forward, we do have, we'll be able to have iPads with surveys that we'll have out with any outreach that goes out. But ultimately, I think it begins with the questions that we're asking. So we're really truly getting a true picture and understanding of how they feel, or what the perception is of the services and of the department. So I think that it starts there. We have not at this point been able to do that just yet. It is a work in progress, but the intent is for it to get out there. And I definitely look forward to a time when we're able to pull and tell you more about what people are saying about the department from social media surveys, from what we're pulling from those 11,000 people that you referred to. It would have been nice to have said, hey, do you have 2 minutes, or do you have 1 minute just to answer 3 questions, but so that's year 2. We're going to get there. We're going to get there. So
Thank you so much.
Mhm.
Does anyone else who hasn't had a chance to chime in, do you have questions or comments?
April and Shantae, this is Craig. So I wanted to chime in and add to what Shantae's been talking about, and it is awesome, all the work. I would mention one of the great things, I know Dr. Mahdi has talked about this before in terms of the great support from this Board of Health, and that is on the budget side. So every one of those outreach items that Shantae's talking about are in addition to the daily work, right? So trying to have the capacity and the wherewithal to send people to all of these events if you think about with the Community Health Improvement Plan, with the St. Louis Partnership for a Healthy Community, there are dozens and dozens of partners, hundreds actually, when you think about it. And everyone's having these events, but the coordination piece that April's talking about, Kristen's talked about, all of you have really talked about, how do we get folks to be able to, particularly in a governmental structure such as we have, to have that budgetary support to send people out, because they're going out on nights, weekends, holidays. That response on a Sunday was that Sal was doing another event that day, caught your email, of course, and responded to it. So it takes that support, and it's not always there, just so you know that.
Yeah, thank you for calling that out. And yes, we have certainly talked about the budgetary needs of all of the really important work that your team is leading. And one of the core functions of this board is to advocate to ensure that the financial needs of public health work are centered when budget decisions or trade-offs are made, which is also in my mind another reason why collaboration with St. Louis County is really important, since everyone's working with constrained resources, collaborating to ensure that you can deploy those resources as best you can with some, efficiency, and work as a team, so that you don't have to worry about doing all that work as kind of a single entity, when obviously community health extends across city and county lines. So I just really thank you all for, the incredible work that you're doing, given the fact that you don't always have what you need, but you are still making so many really wonderful things happen. What I've heard today in this meeting is that the board needs to get some more clarity about its role and function, so we can better support the work that the Department of Health is leading. And also that the Department of Health may have some more specific asks of us. So I think these could be two really great topics for our next meeting, in terms of getting clarity on both ends. Because as we talked about last month, one of the areas that this board is charged with, or at least with, governance, right, is to add, well, we have three slots, so 3 additional people that we can add to this board. And I'm, cautious about adding people when if we as a body don't have clarity about the role and the work that we all should be doing. Adding additional people to that can be problematic, and also doesn't provide always the best entry point for people to feel like they have a valued role and are active. So perhaps we need to assess a little bit more about what is happening currently and where we want to be, so that we can have kind of a softer landing for anyone who joins this board after us, since we are sort of figuring it out now. And then ensuring that our committee work and our work in general is aligned with the strategy of what this public health team is focused on. So those are my kind of takeaways from this meeting. Shantae, I thank you so much for offering a lot of insight into the work that you are doing. Craig, always thank you for ensuring that we have the history and the context and kind of the nuance around how this work has played out or why it's happening a certain way. And I would love for this board as a whole to have that kind of, institutional knowledge that it can build up so we can pass it along to new members as they join us. That actually brings us to the end of our agenda. Oh, I'm sorry. I did not call out. Are there any announcements? That is actually our last agenda item.
Well, I can provide just a thank you to those who assisted with our FAB accreditation site visit. And we have responded to all their questions. And so hopefully we'll get an answer sometime in November about our reaccreditation status. But thank you all for your support through that.
And for those who don't know what FAB is, it's the Public Health Accreditation Board. Yes. And I know Kristen was able to join that meeting. I'm not sure who else from this current board was, but Kristen, do you have any comments about how that process went?
I tend to over prepare. So I had like printouts of everything just because I've been in the hospital. And I remember when JCO would come and, they'd be like, they're going to ask you all these questions. So I had like papers everywhere highlighted. Anyway, I thought it went really great. I had the pleasure of being on the call with Mayor Tashara Jones and Dr. Tim McBride. And we just had a really good seamless process of being able to add our input from where our perspective was with our time as a board member. So obviously Dr. McBride had more institutional knowledge in terms of his, involvement with the Department of Health. And then I just, as a new member, was able to add just kind of how those efforts early on impacted my experience. And so I feel like we had a good time. So I felt like, I don't know, Rhonda, but I'm standing in prayer with you all that all shall be well in November. I'm claiming it. That it'll be good, but it was good if you get the chance to be a part of that in the future should another ask, which I think only happens every
5 years.
5 years. Okay. So I don't know if you'll be on the board then, but it was nice to experience and it felt really good to support the DOH in that way. So it was good.
Well, thank you again for stepping up and stepping in. Yes, I heard the feedback from the meeting was great. And apparently the FAB folks were thrilled with the level of excitement, knowledge, support that the members of this board have been able to offer. So my fingers are crossed, but I don't think you all need luck. It sounds like it went incredibly well. So I will also point out, speaking of collaboration, the next FAB cycle will coincide with the next CHNA cycle for most of our local hospital systems. So just to put that out there, there could be, an opportunity for an even larger regional plan.
Yes, we are already talking about that 2027. Hopefully we'll have a joint community health assessment.
Yeah, that would be awesome. Well, thank you for that update. If there are no further announcements, I will adjourn our meeting. Thank you so much for joining us.